First tonight, our social distancing is working. The number of cases in North Carolina is still increasing, but at a slower pace.
And that is with increased testing. That's a good sign for us, but it's also a sign that we must continue what we're doing right now. North Carolina has more than 4,800 cases, 300 more than yesterday. 86 people have died in the state. Focusing in on Mecklenburg, there are now 970 cases, an increase of just 16 since yesterday.
And right now, we want to take a closer look at those numbers, particularly the number of cases at one local long-term care facility that's now become a hotspot for COVID-19. Of Cabarrus County's 174 cases, 67 are at one facility, Five Oaks Rehabilitation. The health department is now testing hundreds of people there, even those without symptoms, and they expect numbers there to increase. Channel 9's Mark Becker joins us live now in Concord tonight. And Mark, a lot of the people living in this facility are high risk.
Yeah, by definition, Damani, they're vulnerable. Most of them are here because they're physically ill to start with, or not very strong, older, certainly in many cases. Once a virus gets in, it can bounce around. So yes, we learned over the weekend that the county had actually tested 300 staffers and residents here at Five Oaks Manor in Concord. 67 of those came back as positive. We don't know how many of those positive cases are residents here and how many of them are staffers, but the administrator did confirm over the weekend that at least one person was taken to the hospital. Almost everyone, though, is still in the facility here, and that's raised concerns for family members and friends. We spoke with a man named Tom Caudle, whose friend has not tested positive for the virus, but as of this morning, Caudle told us he was still sharing a room with a man who has tested positive.
There's two in a room, and he told me that his roommate was positive. And I said, well, what about you? He said, I don't know yet. I said, well, you still in the room? He said, yeah. I said, well, tell him to move you, or move him, separate.
Now, this is not by any means the only long-term care facility in the state with this issue. In fact, there are a total of 29. Coming up on Eyewitness News at 6, we'll talk about some of the others and why some people feel that some of these facilities may not be doing enough to keep their family and friends safe. Demai?
And we look forward to that report. Mark Becker reporting live for us tonight. And we've been tracking outbreaks at several local nursing homes. And this weekend, we've told you about an outbreak at the Citadel in Salisbury, Rowan County. Health officials haven't released the exact number of positive cases there. An outbreak at the Veterans Home in Salisbury has claimed the lives of 2 veterans. And in Ballantyne, 3 people who tested positive are being isolated at the Pavilion Health Center. New restrictions for nursing homes just went into effect as a result of the governor's executive order. Starting today at 5 o'clock, they're now required to screen residents and workers, and employees must wear face masks.
Doctors say the outbreaks of COVID-19 that we are seeing in local nursing homes are proof of how contagious and dangerous this virus is. Today, I spoke with Dr. Ryan Shelton of Tryon Medical Partners as he tested patients in Matthews.
How do you stop it from spreading so quickly among a population of people that are living in such close quarters?
That's very difficult. If folks need to be hospitalized and they have to, be removed, but we try to track to see where it's isolated at, where it's coming from, and try to spread everybody out the best that you can. Use the same healthcare workers for the same people, ideally. It's just not a perfect situation. It's not a perfect scenario. This is something like we've never seen before.
Dr. Shelton tells me so far Tryon Medical Partners is still seeing a steady stream of patients coming to their 2 testing locations, one in Matthews and one in Dilworth. So far, they've had nearly 90 positive coronavirus cases out of nearly the 800 they've tested.
All right, let's now turn to South Carolina. South Carolina has more than 3,300 cases. 82 people have died in the state. York County has the most cases, and they're at 134. They've also reported 3 deaths. Lancaster County has 65 cases. Chesterfield County is at 22 cases, and Chester County is at 19. Those counties have not reported any deaths.